Good evening, everyone. Myself, Dr. Vinod Kaushik from IIP Digital Media team. I will be the host for today's webinar on breast cancer awareness with the resource person, Dr. Ashima Sharma, being organized by IIP Women's Cell, Ratnagiri District to celebrate the Women's Day. Physiotherapist is the oldest, IAP is the oldest and the largest association representing physiotherapists in India since 1955. The IAP digital media team consists of a group of physios who handle Zoom platforms, webinar, live streaming, and IAP profiles on social media platforms, Facebook, Instagram, Twitter, LinkedIn, YouTube. Follow IAP profiles
अगर ये
on
पेपर
these
गिर जाएगा ना तो मुझे उठा के दे देना पापा
to receive notification for our events such as webinars, workshops, CMEs, conferences, health camps, blood donation drive, and to know about the recent updates on physiotherapy. Subscribe to IIP YouTube channel for notification of our live webinars. In playlist section of this channel, webinars are segregated into various folders on topics like orthopedics, neurology, sports and fitness, pediatric, cardiopulmonary, women's health, research, cancer, rehab, etc. for easy access. The social media links will be shared in the chat shortly. Now I will just hand over to our moderator, Dr. Juhi. Please take over this webinar to continue it.
Evening to one and all present here. I am Dr. Zui Faltankar. I'll be the host for today's webinar on breast cancer awareness with our resource person, Dr. R. Sharma Kesri. This webinar is organized by Indian Association of Physiotherapists, Women's Cell of Association on the occasion of Women's Day 2025. Let me just let you all know what IAP is. Indian Association of Physiotherapists, IAP, is a non-profit, non-governmental organization that represents the physiotherapy profession at national and international level. It was established in 1955. IAP is a member of World Physiotherapy, an international organization representing physiotherapists. IAP has more than 50,000 registered physiotherapy members and over 300 member institutes. It aims at promoting quality of physiotherapy education and practice in India, improving awareness and health of general population. Dr. Sanjeev Jha is the president of IAP. We have IAP Women's Cell under this organization, which is a special platform for female physiotherapists to organize academic, clinical, and social activities across India. IAP Women's Cell functions under the guidance of National Head Dr. Ruchi Varshne. It has 5 zones in India with heads for each. Dr. Pooja Kamble is the West Zonal Head. The state team of IAPWC Maharashtra includes State Coordinator Dr. Suvarna Ganvi, Joint Coordinator Dr. Snehal Patel, and Sub-Coordinators Dr. Uttara Mohan, Dr. Karande, and Dr. Nirali Sangvi. We have 22 district committees in the state. In the years 2019, 2021, 2020, 2023, and 2024, IAPWC Maharashtra has received award for Best IAP Women's Cell State Team. Today's web on breast cancer awareness with resource person Dr. Azma Sharma Kesri is being conducted by IAP Women's Cell Ratnagiri District. Dr. Azma Sharma herself is the district coordinator. Dr. Zui Faltankar is the district sub-coordinator. It gives me a pleasure to introduce our speaker for today's webinar, Dr. Azma Sharma Kesri. She is presently working as Associate Professor at BKL Valavalkar Rural Medical College and Hospital in Physiotherapy Department at BKL Valavalkar College of Physiotherapy, Savarde, Ratnagiri District. Ma'am has done her graduation and post-graduation from Manipal University. She is pursuing her PhD presently. She is heading the Cardiovascular Respiratory Physiotherapy Department, along with taking care of physiotherapy in all the ICUs. With 13 years plus of experience in cardiopulmonary physiotherapy, including critical care units and fitness, she has been deeply involved in serving rural community on improvising cardiovascular health and fitness. She took initiative to start separate cardiopulmonary rehab and fitness unit at Valavalkar Hospital along with the support of the management who always strives for betterment of rural community. She has keen interest in research and has Scopus indexed publications, have written chapters in books and have a patent on ICU specialization bed on her name. She is AHA certified BLS and ACLS provider, master trainer in pulmonary rehabilitation by Johns Hopkins Rehabilitation Institute. She is active member of IAP, district coordinator of Ratnagiri Women's Cell, American Thoracic Society, European Respiratory Society, CVPR Society. Today, ma'am will be sharing insights on importance of breast cancer awareness. We are truly excited to learn from her. Please join me in giving her a warm virtual welcome, Dr. Azma Sharma. Ma'am.
Good evening, everyone. Thank you, Jui, for introducing me and telling so kind words. So kind of you. As we gather to celebrate Extended International Women's Day, a day dedicated to honoring the incredible strength, resilience, and achievements of women around the world. It is also a moment to reflect on challenges many women face and to raise awareness about critical issues affecting their health and well being. Today, I want to shed light on one such important issue, that is breast cancer awareness. Breast cancer still remains the most important and common cancer concern among the women globally. While significant strides have been made in the research, treatment, and early detection, there is still so much to be done at the ground level. Raising awareness means more than just knowing the statistics. It's about empowering women with the knowledge to recognize early signs, symptoms, regular screening, and fostering a supportive community for those affected by the disease. Early detection truly saves lives. Regular self examination, annual mammograms for those above a certain age or with a family history, and routine checkups still remains the stalwart in screening and treatment of breast cancer. Remember, catching breast cancer at an early stage greatly increases the chance of successful treatment. Here I would like to start to share my general knowledge, or let's say a common discussion point for mainly to the common public, those who are unaware of what exactly it may be concerned in their family, friends. So it will not be a glamorous medical terminologies or basic. I will be talking so that even those who are educated but they don't know exactly what to be done if they, because cancer still remains a very big bird in the family. So it will help you at least to screen out at your family or friends level. And if they find across any such signs and symptoms, they can immediately seek the medical professional help. So I'll share my screen now. Please let me know if you can. So is my screen visible?
Yes, ma'am.
Fine. So I'll be talking a breast cancer early detection save lives. So contents for today's talk will include introduction and statistics, risk factors, anatomy of breast, signs and symptoms, types, stages of carcinoma breast, importance of early detection screening, treatment prevention and awareness, including myths and facts, and conclusion with take-home message. So what is cancer? So those who does not belong to medical fraternity, I believe there are many people out there. So for them, cancer is not any individual extraordinary disease. It's just the cells which are already present in the body they grow in an uncontrolled and abnormal manner. They can spread to any parts of the body. Breast cancer, in breast cancer cell, they begin to change, grow without control, and they no longer die. It is very most frequently cancer which happen in women. So you can see in diagram underfoot where there is a normal breast cell versus a cancerous cell. So global statistics include there are over 2 million new cases worldwide each year which are being detected by breast cancer, reaching 2.3 million in 2020, accounting for 11.7% of all new cancers and almost 684,996 deaths worldwide. It is a leading cause of cancer-related deaths among women. 1 in 8 women will be diagnosed with the breast cancer in their lifetime, and incidence increases with the age. All women are at risk. So we need to know who are at risk. So risk factor includes modifiable and non-modifiable risk factors. So gender, that is females, are most commonly involved. There are 1% chances that male also can get it. Race, it is most common in whites. Age, the risk factor, it increases as the women get older. Family history of having any kind of cancer or genetic mutation of BRCA1 and BRCA2 cell gene mutations are at higher risk. Menstrual history of having early menses or late menopause are at risk factor of having a breast cancer. Childbirth with first child after the age of 30 or having no children at all are also at risk. Now, these were all non-modifiable risk factors. Modifiable risk factors includes obesity, alcohol and fatty diet, lack of physical activity, stress, radiation exposure, maybe occupational, hormones, and especially estrogen in hormone replacement therapy for people, women take in thyroids, and including birth control pills. And females, those who are obese, tend to have heavy breasts. So the thick fibrous tissue of breast tissue are more prone for developing lumps. So factors that can be controlled are obesity, lack of exercise, alcohol, breastfeeding, not having children. So anatomy of breast. So everyone might have read in the school level or seen at least the breast tissue. In detail anatomy, it consists of a nipple. Behind that is areola. Inside there are ducts which are connected to lobules and axillary lymph nodes. It is like fluid connection channel inside the breast. So what are the signs and symptoms of breast cancer? So any kind of change in skin color or texture, any kind of change in the size or shape of the breast, change in the appearance of the nipple, any kind of discharge from the nipple that exclude the breastfeeding mother, that's normal. Lump or thickening in the breast tissue. See here, you can see that retraction, nipples are being retracted, the PUD orange appearance. These are the signs, and even the males have it. So what are the types? So as we all know, depending upon the anatomy, the breast tissue has milk ducts, nipples, lobules, and lymph nodes. So depending upon the involvement of the tissue, it could be ductal breast cancer, lobular blood cancer, mixed blood cancer, and inflammatory breast cancer. Now, what are the stages of breast cancer? This is very important. Why? Because whenever, unless we do a self-examination or screening, we might miss the early stages. So that is where I wanted to shed light upon that whenever we have any family or friends which are at either of the risk factors, we definitely should focus on educating them to do a self breast examination so that it could be detected at early stages, because it has 0 stage, 1 stage, 2, 3, and 4. Wherein 0 or early stages, cancer is still inside the ducts or lobules and it has no spread around the surrounding tissue. In stage 1, the tumor is small, which is less than 2 centimeter, and no lymph node involvement is there in stage 1A. Stage 1B, tiny cancer cell is found in lymph nodes. Stage 2, there is a large tumor and some lymph node involvement is there, but still it is more or less equal to 5 centimeter and might have spread to 1 to 3 lymph nodes. Stage 2B, the tumor is more than 5 centimeter, but there is no spread to the distant areas. Stage 3 includes locally advanced and more lymph node spread, which has ABC stages, wherein A stage, wherein there is cancer in 4 to 9 lymph nodes. 3B, where cancer invades skin cell, chest wall, and it might be inflammatory as well. 3C, where the cancer involves more than 10 lymph nodes. Stage 4, which is metastasis, wherein cancer is spread to the other parts of body like lungs, liver, brain, and bones. You can see how it looks like on the diagram, wherein the stage 1A breast cancer tumor is just 2 centimeter or smaller. 1B, the lymph nodes are slightly involved, and in 1B second, the tumor could be either of 2 centimeter or smaller. So a change in your breast you see or feel does not mean that it is a breast cancer itself. However, any change should be checked by a healthcare provider immediately. Importance of early detection. Early detection is the key. Localized cancer has a better prognosis. If a breast cancer is found and treated early, the 5-year survival rate is 98%. Now we comes to the screening of breast cancer. Breast cancer screening includes breast examination regularly, breast ultrasound, mammography, breast MRI, breast biopsy, and staging if it has been diagnosed. Screening includes breast self-examination monthly as early as at stage of 20. Clinical breast examination every year from the age of 20 to 39 and yearly from 40. Mammography should be done annually from the age of 40 or as early if at all any risk factor is present. Ultrasound and MRI for the women which are at higher risk. Now we come to breast self-examination. Opportunity for women to become familiar with their breast. Monthly exam of breast and underarm area should be done. You might discover any changes early. Should be begin at the age of 20 and continue monthly. Who should do the breast examination and when should be done? So as I said earlier, every woman at risk and after 20 should be doing it. When you should do? Menstruating women after 5 to 7 of beginning of their period. Why? Because usually many females, they tend to have a tender breast during their menses, which does not indicate any sign of breast cancer. They can misdiagnose. Oh, I might got a breast cancer. Oh, I am at a risk or what. So once you have finished your period, after that you can do it. Menopausal women, same date every month. Pregnant women, same date every month. And breast cancer self-examination should be performed at least once a month. And examine all breast tissue, both the sides. So how it's to be done? I'll just throw a light on that. You all have to lie down and put your left arm under your head like this. Use your right hand to examine your left breast with your 3 middle fingers flat, moving gently over circular motion over the entire breast, starting from underarms to sideways in a circular manner. Use different levels of pressure, light, medium, and firm over each area of your breast. Am I clearly visible?
Yes, ma'am.
Okay. So you need to cover all the areas of the breast in a circular manner. And remember, please palpate with your tips rather than whole 3 fingers. So the contact point should be your this, the tips of the fingers in a circular manner, starting from side, circulating manner with all light and firm pressure, underarm, and similarly in the both. So this is how you do your breast tissue, palpating your breast tissue with your fingers. Second, look at your breast while standing in front of your mirror with both hands on your waist or your hips. Look for any kind of lump with new differences in size of the breast shape or size and swelling or dimpling of the skin. Raise one arm and the other so you can check under your arms as well. Then you can squeeze your nipples of each breast gently between your thumb and index finger. Report to the healthcare provider right away, immediately, if you find there is any kind of discharge or fluid from the nipples or any kind of lump or changes in your breast. I'll just play a small video since we are having many people from Maharashtra also. So I have made this video in Marathi so that they can understand it. If anyone wish to, let me demonstrate in Hindi, most welcome. I'll demonstrate in Hindi as well. मधील बदल नेपाळचा भाग करायचं So this was a small video demonstration of how you need to check it practically. So now when we all are so educated and now since social media, everyone is so aware, but still so many of us don't do breast self-examination. I asked out of almost 50 plus participants, how many of you females have done this amongst yourself? Raise your hands. To be very honest, before thinking of taking this talk, even I have not done it. Why so many of you don't do? If we think we are at risk, we might fear that, oh, what if I get positive? There is no need to fear. The early you detect, the better is the prognosis. Embarrassment. What if my family, my friends will come to know that I'm suffering from breast cancer? Youth, they will think, oh, this is not my kind of disease. I am young, I am healthy, I won't get this disease. Lack of knowledge, okay, I could be at risk. Too busy and forgetfulness. Many of us comes in this category. A mammogram is also very important. It is an X-ray of breast, kind of detailed X-ray to detect. It can detect breast cancer 2 to 3 years before even a lump can be felt manually. So that's why the women or the ladies, those who are at risk, should annually perform a mammogram at least after age of 39-40. It has shown to save lives of patients. Normal mammogram does not rule out possibility of cancer completely. So if you think that mammograms is normal, but you see or find any kind of change in your breast tissue, please immediately seek advice of your physical. Women asymptomatic, those who are asymptomatic and above 40 years of age, should have a mammogram every year. Now we come to the treatment part of breast cancer. I am not going into the depth of it because it's been already known and been taken. But to the people, those who are not aware or newly joined, I'll just touch the topic about it. Treatment includes surgery, radiation therapy, chemotherapy, targeted therapy, hormonal therapy, which is an adjunct to the surgery depending upon the stage of cancer. Emotional and psychological support. Once an individual or a lady is being diagnosed with breast cancer, we should not make her isolate that, okay, this she has got cancer, now finished. We should have a support groups created in our families, neighborhoods, a place, workplace, hospitals. There should be regular counseling sessions to be given to them so that they do not feel left out or depressed. Family and community active involvement is must. Mental health strategies should be incorporated. Improve body image, self-esteem, and emotional well-being. For example, a lady or anyone for that matter, nowadays we have lot of simple back pain because of which ladies get into depression. Just because of constipation, ladies go into depression. Imagine once they are diagnosed with a cancer, what they will be feeling. So we should actively involve them in counseling session, or maybe we can make a small groups involving like whatever their hobbies, so they can regularly come, and at least 3 to 4 times a week they can join the groups. They can at least in, even you can't go anywhere in your community, in your neighborhood, you can create small laughing clubs for them, include them in the any playful activity, any workout activity like dance or let's say gym or whatever. So they will at least feel good about themselves, that this is nothing, any big thing has happened to me, I can overcome it. Now, surgery includes lumpectomy whenever there is a small lump, modified radical mastectomy where whole blood, this breast tissue is being removed along with the lymph nodes, and radical mastectomy reconstruction. This is how a breast look like after reconstruction. This is first one is pre-expander and implant after simple surgery. And after surgery, there are a lot of cosmetic issues. So nowadays, expander and implants are being used so that to give a normal cosmetic look and to prevent ladies from getting embarrassed. Now, physiotherapy role. It plays a very important role in management and at least handling the cancer patients, which includes even pre-operatively, post-operatively, and long-term goals, including pre-radiation. So pre-operatively, we all know that any kind of pre-operative patient need to have a counseling and make him mentally and physically prepare for the post-surgical complications. And also during surgery, any kind of muscle is being cut, it gets strength gets degraded to with 1 grade. So we need to prepare patient accordingly, teach him breathing exercise to overcome the post-surgical complications, strengthening exercises to prepare a patient for surgery, and educating patients, and managing and prevention of post-surgical complications. We need to teach them pre-operatively itself. Why? Because Post-surgery, they will already in a lot of pain of surgery, sutures, mobility will be reduced. So they might not understand what are they exactly supposed to do. So pre-operatively, you teach them, demonstrate them all the exercise actively, breathing exercise with the rationale that, okay, you need to do this because you might face this problem post-operatively. So this is how you have to do. Demonstrate and ask them to demonstrate again and correct them if they are not doing it properly. Post-operatively, we need to take care of pain management, early mobilization, lymphedema prevention and management, breathing exercise, and post-surgical complication management. So once is patient surgery is being done, patient is in ICU. So very first or day, depending upon the surgeon's reference, we start the treatment maybe immediately or POD day 1, wherein we take care of his pain. We can synchronize our treatment sessions with the analgesic patients having. Then early mobilization. Why? Along with the surgery itself, patient is bedridden in the ICU maybe for a week or so. So again, the bedridden complication could develop, to prevent and manage them. Then, since the lymph nodes are definitely to be removed along with the carcinomatous tissue, so managing the lymphedema and first of all preventing it, because it won't come very first day. Okay, so we need to start prevention, working at the prevention level. And as I said, post-surgical complication, which is very common in all the surgeries, to manage and prevent. Then long-term physiotherapy goals include the strength training, because muscles are being cut, the maybe the pec muscles, the side, your intercostal muscles. So they are being grafts are being taken, your neck muscles, everything. There will be all your posture corrections are being taken care. Their cardiovascular fitness is to be taken care. So that is all long term. So once the patient is out from ICU, he will be in ward, and at the discharge, we need to give a proper home program and the rationale of their long-term goals to come and OPD basis for taking the treatment. Now, what I wanted to focus on is prevention. What can we do for preventing this? First and foremost, we know that healthy diet rich in fruits, vegetables, whole grains, regular exercises, at least 150 minutes per week should be done as per WHO. Limit alcohol, no alcohol, or at least not more than 1 drink per day. Those who are actively involved should limit it. Maintain a healthy weight. Avoid smoking as much as possible. Because as I said that there are risk factors which are modifiable. So this all prevention is targeted about on the modifiable risk factors which we can work upon to prevent ourselves to at the risk of breast cancer. Awareness. So how we can, spread the awareness about it. Encourage regular self-screening. So as I have already shown you the video, I've already spoken on it. The recording also will be available. So those who are having females, especially at risk, should start regular self-screening in the families and friends. If at all any kind of you find any discrepancy or the signs and symptoms I spoke about, regular medical checkup should be taken care. Please share the information, whatever you get on it, with your families and friends, and support breast cancer research and charities whenever possible. Now, very important, since in India we have lot many myths and facts along with any kind of individual disease. So breast cancer do have a lot of myths and facts, which include people think that talking about breast cancer can cause to cancer. No, it's not like that. Touching the breasts too often will lead to cancer. No, it is also not like that. Using illegal drugs can lead to cancer. No, not the breast cancer exactly, but can deteriorate your health. Herbs cure breast cancer. No, it could help to prevent your secondary modifiable risk factors like green tea or something. But then once you have been diagnosed with a breast cancer, then definitely no herb can cure it. You have to seek a medical advice. A bruise on the breast will lead to breast cancer. No. If an incision is made during breast cancer surgery, it can spread to other parts of the body. No, the surgical incision will never lead to cancer spread. Getting too many mammograms lead to breast cancer. That is also not true. Breast cancer only affects older women. It can affect as early as 25, 30 years of lady. If you have a risk factor for breast cancer, you are likely to get the disease. No, that is also not true. If you are obese, not all obese females will get breast cancer. Not all the ladies, those who had early menarche or late menopause, will have breast cancer. So it is a risk factor, but not necessarily that you will have it. Using antiperspirants like roll-ons into underarms will lead to breast cancer. That is not true. But you need to maintain your hygiene. A breast cancer diagnosis is an automatic death sentence. No, that is not true. Early detection is your best prevention at the early stages when it is there. So for that, regular checkups are there. So once it is diagnosed, depending upon the stage, it is manageable and curable. So what I want to say is, take charge. Know your risk for your breast cancer. Be aware of breast changes. Get screened regularly. And again, I'm telling, early detection is your best protection. Thank you so much. Do you have any questions for me?
Ma'am, we have questions in the chat box.
Yeah.
What lifestyle changes can help reduce the risk of breast cancer?
Fine. See, we all know that mobile has taken away our physical activities, starting from school children, right? Now we see lot of juvenile obesity. Okay, reduce physical activity. Okay, so we all should include a healthy lifestyle at least 4 to 5 days in a week. If anyone is having a night shift, make sure at least for one hour or 45 minutes you are getting time to your body. So lifestyle changes, including timely eating, timely sleeping, controlling your weight to as per your BMI, height and weight. I'm not talking about your crash dieting. I'm talking about the healthy eating. Okay, so one who wants to reduce weight should be physically active more than you're going for the crash diet. So very important thing you can start is just start the walking part, brisk walking. Okay, today I'll walk for 10 minutes. Let's start, because most difficult part is to get started. If you think, okay, from 1st of April or from 1st of January, I'll go for gym or I'll start my working out. No. The day you feel I had to work out, I need to work upon my body, I need to have a self-image, start that day. Go take a 10 minutes walk after dinner, come back. You'll feel good. So maintain your weight, maintain healthy lifestyle, prefer carrying homemade food. May it be whatever is possible. Because if you're not carrying homemade food, whatever is available at a click of from Zomato or Swiggy, you will have it. Okay, let me have it and continue. I have a lecture, I have a presentation, I have a meeting. So whatever is there, so it will, once you are at home, you can tend to have simple salads in your tiffin box. You can have dal in your tiffin box. Any kind of sabzi gravy made at home is anytime 100 times healthier than any kind of lavish food in the from outside. So food, dietary, timely sleeping, all these lifestyle changes definitely reduce your risk factors of any kind of NCDs or cancers. Am I clear?
Ma'am, second question we have, how significant is family history in determining breast cancer risk?
Yeah, it is very important. As I told you in the non-modifiable risk factors, that there are genes, HCBRA mutation genes. See, let me tell you, all these genes are already present in our body. It is just what activates or changes or hits that gene to get activated or mutations. So anyone who is having a history of cancer is more on the risk than a person who's not having a family history. So if you are having a family history, You let's say, okay, maybe there is someone in my family who had a history of cancer. As early as possible, try to have this self-examination. And if you are obese, you are having a family history, you have some sort of addiction, you have sedentary lifestyle, try to get a mammogram done at least once annually.
Ma'am, Dr. Jim Brown says after a meal, walk. Simplest formula to remember.
Pardon, come again?
After a meal, walk a mile.
Yeah.
Yes,
No,
it's
not immediately after a meal, because your blood will go for the digestion. So immediately after having a meal, give some sort of maybe half an hour of a break and then you go. So as per WHO, it says that everyone should walk minimum 10,000 steps a day. For which you can start not 1 hour of walking or brisk walking, small things. Take a steps, avoid lift. Go walking to your, let's say, hospital working area if you stay nearby 1 or 2 kilometers. Try going to catch a bus or train walking instead of taking an auto. I understand morning hours we have a rush, but in evening hours, while coming, we can walk, right? So these small things add up on the physical activity. If you know that you have, let's say, 2 to 3 hours of continuously sitting at one place. So keep reminders if you're forgetful in your mobile. Half an hour reminder that okay, if mobile rings, I have to just go get up, have a water from the water cooler, or let me stretch for a while at my workplace. Go and take a walk in and around my working area and come back. So that will avoid your sitting at one area. Add up onto physical activity basically. And slowly and steadily, when you see results, you will definitely tend to, increase your physical activity levels. No one who has never worked out or have never gone to gym will start doing 1 hour of regular gym from very one day. If he's so strongly willed, even if he starts, he'll get bored within a week or so. So I'll suggest try to initially join things which are more finding interest to you. Like many people, they like to, dance. Many people, they like to work out. Many people, they like to play. So whatever finds or catches your interest, go join that. Next question.
And can you explain in brief about lymphadenopathy?
Come again, Zui, I could not hear it.
Lymphadenopathy.
Zui, your voice is breaking.
They are asking lymphadenopathy. Please explain in brief.
Lymphadenopathy.
Yeah, sure.
Okay. So any kind of immune system glands which usually get swollen up. See, we have lymphatic drainage system. Those who are non-medical people here in the group, let me tell you, other than blood circulation, we have got fluids in the body, which is called as lymph. So that is also having a circulatory system separately, for which they get drained into the lymph nodes. Okay. So once if the lymph nodes are being removed, so where the body fluid will go? Okay. So it gets removed during such surgeries. Wherever, if there is kind of any surgery, so doctor will, along with the healthy tissue or cancerous tissue, will remove the lymph node as well. So if at all there is, for any reason, there is any kind of swelling or any infection of a lymph nodes or that area, that could lead to lymphadenopathy. They get enlarged. Bacterial infections, they come. Viral infection, they will come. There will be sudden swelling over that area. And autoimmune diseases, infections, and malignancies, all these are the reasons for lymphadenopathy. Maybe even the drug reactions as well. Am I audible?
Yes, ma'am. That's
See,
all for the
I kept
questions
this
today.
very short because I did not wanted to make it a very bored session. Since already so many talks have been done on breast cancer, what it is, how it is spread, and all. I wanted to take a talk to spread the awareness about breast cancer, what you need to do at your level. So start at your home level. Since for that I need to just tell about the risk factors, what modifiable, non-modifiable, and who are as risk, what need to be done, when need to be done. So once if you come to know that okay, these and all things are there, at least you can, if someone is discussing also as a friend with you, and if you know about it, you can immediately guide that friend. So I just wanted to have a brief, let's say, interactive session, that please don't take it as a stigma and speak about it, spread awareness about it, starting very basically with the self examination screening in your family and amongst your friends and colleagues. Yes, Zoe?
Yes, ma'am. Done for the questions. Yes. Moving on to the vote of thanks. Good evening to all. I find a great pleasure and privilege to propose the vote of thanks on this memorable occasion. Let me first of all start by giving glory to the Almighty God for making today's occasion a resounding success. First and foremost, I would like to express my deepest gratitude to our keynote speaker, Dr. Azma Sharma Kesri, for delivering a thought provoking and insightful presentation on breast cancer awareness. Your expertise and passion for the subject matter were evident and throughout, and we were truly grateful for your contributions. I would like to extend my sincere appreciation to our IAP President Dr. Sanjeev Jha, IAPWC Head Dr. Ruchi Vashne ma'am, and West Zonal Head Dr. Pooja Kamble ma'am. My heartfelt thanks to our IAPWC Maharashtra team, Dr. Suvarna Ganbir ma'am, Dr. Snehal Patel ma'am, Dr. Uttara Mohan ma'am, Dr. Priya Karande ma'am, and Dr. Sangvi ma'am, for your constant support in planning and executing this webinar. Your dedication, expertise, and attention in detail to ensure a seamless and enjoyable experience for all participants. Finally, I would like to thank each and every one of you for your active participation and engagement throughout the webinar. Your thoughtful questions, comments, and insights added a richness to the webinar and made this event a resounding success. Thank you all once again.
Yeah, thank you, Zoe. I just want to add upon, since this talk we had planned on 8th and 9th on the Women's Day, and 9th since India's match was there, so many of the participants might not be available. So considering women awareness on breast cancer, it goes beyond the medical facts. Okay, it means breaking the stigma and offering support to those battling with the breast cancer and standing by the survivors as they reclaim their strength and confidence. Let us voice and to spread the hope and knowledge, and let's create an environment where no woman feels alone in her journey. Let us not only celebrate the women's achievement, but also commit to advocate their health. Let's encourage one another to prioritize our well-being and build a future where every woman has access to the care, information, and support she deserves. Thank you, everyone, once again for being part of this important conversation. Together, we can make a difference, one step, one voice, and one heart at